I'm Dr. Anthony Maloof on Eyes and Faces and Corneal and Oculoplastic Surgery in Sydney, and welcome to this video edition on keratoconus, obesity and cataract. So to remind you, keratoconus is a problem at the front of the eye, the front lens of the eye where it's bent out of shape. Obesity, we all know, it's people with an BMI of more than 40, but also cataract, the second lens in the eye. So your eye has two lenses, the front lens, the cornea, and the lens inside, the cataract. So what have these all got to do with each other? Well, this is a story of a very, very large young man, a lovely young man supporting a family, 28, 198 kilos, huge. The problem as you get really big is and look at people that are very overweight, their eyes will bulge forward. And as they lose weight, the eyes will settle back in. So there's this myth that it doesn't happen, but in fact it does. Also, when you're overweight, you often have very abnormal oils, they irritate your eyes, you tend to rub more. And what I find is obese patients tend to rub their eyes harder, for longer, and cause more damage. That is a problem that I think is multifactorial. So what's the problem with rubbing? Well, when you blink, just close your eyes, your eyeball goes back a millimeter. As your eyeball comes forward, there's more pressure on the eyeball, and then you rub it and you can actually squash it and you can push the front of the eye onto the lens, and that's exactly what this guy has done. His disease to the cornea is so severe, it's so widespread, it's what we call keratoglobus. It's almost the entire cornea has thinned. So he's going to need a huge stromal transplant. However, you will see from these enclosed photographs that he also has a white lens. You can see it, just look at the end of the room, you can see the eye's white. So what's the problem with that? Well, he's basically light perception. He's blind, more than blind. He's legally blind at 660. He's light perception. He can see light, no movement. He's got to work. But the cataract presents me a problem as a surgeon. To fix the cataract, you need to have the cornea fixed. To fix the cornea, he needs a stromal transplant. And the healing time is 3 to 18 months minimum, probably a bit longer. So what's the problem, you might say? Well, a white cataract goes downhill fast and it can become toxic, cause inflammation in the eye and even blind you. So I'm sitting on a ticking time bomb. I've said to this young man, look, start your weight loss. He came back in and within 1 month, he'd reorganized his house, his family got together and he's losing weight. We're going to go in and do a stromal transplant and try and restore the front of the eye, which is critical because once that's done, we can then measure the lens and fix the lens inside his eye. So this is when corneal transplantation surgery becomes a priority and we have to do it as quickly as possible. I hope that all makes sense. Obesity, keratoconus, cataract can go hand in hand. Thanks again for watching. I'm Dr. Anthony Maloof of Eyes and Faces and Corneal Oculoplastic Surgery in Sydney.